This conference will now be recorded.
Welcome, everybody. We are starting our journey as far as becoming EMTs. First chapter, we're going to be talking about the introduction to emergency medical care. So with emergency medical services, we got to keep in mind that EMS has only been around for about 100 years in comparison to law enforcement and fire departments who've been around for hundreds upon hundreds of years. And that's why when we look at the history and how much attention and the different dynamics of EMS, it's so new in comparison to other protective services. So let's dive in. The emergency medical services system. When we're looking at the history, we did start to see some pre-hospital care develop, but it was very minimal up until about the 1920s, 1930s. So within the 1790s, this is when the French army actually began transporting wounded soldiers away from the battlefield. So this was our first introduction to transport of these individuals. Now, there was no care received while they were on the battlefield. However, we got our first taste as far as kind of our ambulance logistics, as far as removing those individuals from that point of harm. Within the Civil War era, Clara Barton, she helped establish the American Red Cross. So the American Red Cross has been a very pivotal role as far as emergency medical services and pre-hospital care, because it's been providing education and training for community members to go ahead and provide that first level of care that somebody's going to receive in the event that they're injured and or hurt. The American Red Cross is very predominant still today, and they do have influences between the American Red Cross and then also emergency medical services. In World War I, World War II, Korea, and Vietnam, this is where we really started to see an advance in trauma-related pre-hospital care. And so these individuals were actually receiving care out on the battlefield by individuals who are trained within emergency medical services. And this is when we first started getting data and statistics in relation to care received before individuals actually got to a physician, a hospital, an OR, or a clinic. So this was a very pivotal role as far as us getting trauma research and how we can start helping patients. Now, again, this is more military based, but take this aspect and relate it to today. All of our trauma research that we receive and mold that into emergency medical services is all from the military. And so you see, when the United States is involved in a conflict and involved in a war, a lot of our protocols and guidelines change, get updated. We receive new technology, new equipment, new guidelines, and that's because we are molding that research that they're receiving from their specific cases, and then we're tailoring it into emergency medical services. Now, again, this is military based, but now when we're looking at non-military, we're starting to see the United States start to build up that healthcare aspect that is pre-hospital care. So early 1900s, horse-drawn carriages were providing transport of individuals who are sick and or hurt from their point of injury or point of illness to a specific hospital. Now, the first ambulance services that provided that transport, again, they did not provide any care. They just simply provided transport. Most of these services were run by the funeral homes and or by coroners. Oops. And then within 1966, this is the pivotal date that emergency medical services really started. And it's because of the epidemic that was motor vehicle accidents on the highway and so many people dying from those motor vehicle accidents in relation to that they were not receiving pre-hospital care before they actually got to the hospital. So within 1966, this is when the National Highway and Safety Act. So they charged the United States Department of Transportation within developing the EMS standards, in which we still abide by today. So if you find it odd that EMS is governed by the United States Department of Transportation, it's because of this specific Highway and Safety Act that was developed in 1966 in relation to all of the motor vehicle accidents and all of the deaths that were associated. Now, they developed EMS standards throughout the country. States need to adopt those EMS standards and then actually govern state by state. In 1970, this is when the National Registry of Emergency Technicians was founded and established as far as professional educational standards and training. Now, we're going to talk quite a bit more later on as far as certifications and licensure. But this was a very pivotal step as far as ensuring state by state that if you were an EMT in Minnesota and you're an EMT in Florida, that you were still getting the same education and training in order to obtain your National Registry of EMT certification. Prior to 1970, they did not have that established. In 1973, this is when they passed the National Emergency Medical Services System Act, which gave a lot of revenue and funding and resources to states, to local governments in order to establish emergency medical services. So here again, we're going to brief the timeline. This is Clara Barton, the establishment of the American Red Cross. These individuals are starting to receive very basic level care on the battlefield and then get them transported away. Here, an example of World War I, again, very basic level of care, but this is where we started to see ambulances being transport vehicles and then starting to receive some care in the back of those ambulances. Now, fast forward to Korea and the Vietnam War. If you ever watch MASH, this is a great example of some of that advanced care and advanced technology that really took place during those two wars. So we are starting to see advanced life support actually take place during the Korean conflict and the Vietnam War, and that also associated back to the United States. In the 20s, 30s, and 40s, certain states, certain organizations really started highlighting and improving the level of care that they were providing via pre-hospital care. But you can see that this individual's actually got an IV established. It's funny that you look around and none of them are wearing any personal protective equipment. So then if we go to the civilian side, we can start to see the first ambulances actually showed up. So this is an example of Vancouver in Canada. This is one of their first ambulances that they had, and that was actually governed and operated by the General Hospital there. Fast forward, and within the 70s, we started to see more ambulances equipped with more advanced technology and equipment so that these individuals were actually receiving a relatively high level of care in the back of that ambulance and then within the pre-hospital setting. Prior to the 70s, most ambulances, in order to operate and work on one, you needed your basic first aid card. And so you could stop the bleed and you could splint and you could move that patient from where they were laying to the back of the ambulance, and that was pretty much it. But within 1966, with that Highway Safety Act, and 1970 with National Registry, we saw an uptick as far as that pre-hospital care being improvised. And then if we fast forward to today, more and more significance has been played on emergency medical services being an integral part of the overall healthcare setting. And this really came about via the American Heart Association with their chain of survival when we're looking at sudden cardiac arrest events. So sudden cardiac arrest, which we'll dive into when we meet for a BLS CPR, has got a lot of links that need to be embedded within each other in order for that patient to survive. And the first 3 to 4 links are all associated with community bystanders, and emergency medical services. And that's why we're getting much more funding, resources, and props as far as what we do as emergency medical services. And not to mention, we're continuously improving paramedics, EMTs, and developing higher levels of standards. So this is a special rescue EMS ambulance unit. So this could be used for MCIs. It can also be used for critical care transport services. So you see a lot of rigs like this in some relatively large metropolitan areas where they have specialty hospitals. Like down in Minneapolis, you have the Children's Hospital. In Rochester, you got the Mayo Clinic. So a lot of these ambulances are actually staffed by physicians or nurses, and they're basically mobile intensive care units or mobile pediatric intensive care units. So EMS today, these are the big standards that emergency medical services has to abide by in order to continuously operate and improve and meet all of the state statutes and the guidelines associated with being an organization in emergency medical services. So first we have regulation and policy. So every EMS organization has to have a set protocol and standards as far as medical guidelines, and they also have to follow the regulation and policy that the specific state governs that emergency medical service. So we, as far as being in the state of Minnesota, are governed by the Emergency Medical Services Regulatory Board. So that specific agency within the state of Minnesota governs all of the EMS agencies within the state of Minnesota. We also have resource management. So every EMS agency has to have a hierarchy of leadership in order to continuously improve and meet the regulations and policies that are governed. EMS is very, very unique when we're looking at different safety agencies, is because we have so much freedom in comparison to registered nurses who oftentimes do the same job, but they're directly overseen by that physician. We're out in the field, we're on our own, we're in the middle of the woods, we're on the side of a road, we're in somebody's private residence. A lot of the stuff that we do, we have to make critical thinking decisions and then act upon those. But with resource management, they are going to give us the tools necessary in order to make those decisions. Human resources and training, again, human resources with that leadership aspect, we're no different than any other organization that's out there. We have to abide by the rules and make our workplace a safe, happy, and friendly environment. As far as training goes, there's a variety of different trainings that EMS has to do. We have to provide continuing education in order to improve our skills. We need human resources training. We need OSHA training in order to abide by all the regulations set forth by them. And then transportation. So dividing up EMS, we have non-transport services and we have transportation services. Regardless of that, everybody needs to get to that specific call. So with transportation, all of our emergency medical services vehicle units has to be governed by the state. Now, if you're a non-transport service, you don't have the EMSRB coming in to check your specific vehicle. If you are a transportation service, they will come in every 2 years and actually inspect and check all of your transportation vehicles. Facilities, depending on what your EMS agency is, you might have a standalone facility as far as your EMS unit. A lot of departments like Cloquet Area Fire District are both a fire and EMS agency. So you got your ambulances that are housed at the fire station, and then other facilities, especially when you have hospital driven and hospital operated EMS services, they actually have an EMS bay within the hospital. Communications, very important. Every emergency medical services rig has to have a radio unit attached to it so that you can talk to dispatch And then if you're a transport unit, you have to have the capabilities in order to communicate with any receiving hospitals that you might need to go to. Every ambulance too is going to have most likely cell phones that you can use in order to communicate with them. And then we have public information and education. Why this isn't one of the first ones to go is beyond me. And it's because for so long, fire, police, EMS, we have all been retroactive as far as an emergency occurring. I really want this to focus your attention once you enter your career as an EMT and look for opportunities in order to improve your community that you're actually working under. Anything that we can do to prevent an injury, prevent an illness, that is going to go so far beyond our great abilities to provide cardio resuscitation efforts in the event that somebody goes into cardiac arrest. So bike helmet drives, blood drives, community paramedicine, providing information as far as fire protection within the house. Think of those things and how many lives that we can truly save based on public information and education in comparison to going to a single patient time and time again when those tones go off. And then, of course, we have medical direction. So our medical director is going to be in charge of overseeing all of the EMS agency. They're basically our leader in this aspect. In order for us to practice, we actually go underneath the medical director. So we're acting upon the medical director's license. So they're going to ensure quality assurance, quality improvement, making sure our protocols and guidelines are up to snuff, and then also our training and education and how well we're doing out in the field is associated underneath their license. We then have trauma systems, medical systems, and this is where we start building upon the more hospital-driven areas, and then also some different specific sections within the state. So each section within the state is divided up, and there's a specific trauma system correlated hospital, pre-hospital, and we take a look at trauma research, specific calls that agencies have been on within that area, and then we look at how we can improve that specific trauma system. And then evaluation. So this goes back to quality assurance and quality improvement, which we're going to talk about in the next couple of slides. But we always want to evaluate our performance, and we always want to continue to improve that performance. So components of the EMS system, these are the things that we need in order for us to operate. First of all, we need a patient, followed by somebody calling 911, activating that 911 system. Now, obviously, we don't need this to happen every time, because once you get into your career, you'll find out how many times that you're driving around and you witness a car accident or witness somebody collapse on the sidewalk right in front of you. But in generality, we're going to have a patient, and they're either going to suffer from a medical or trauma-related event or both. Maybe somebody's driving in their car and their blood sugar drops, and then as a result, they actually get into a car accident. But then a citizen is going to call 911, and the other end of that 911 is going to be an emergency medical dispatcher. These individuals are really your lifeline. So be nice to them over the radio. They're going to provide you with as much information as they possibly can. They do a tremendous job. They don't get the kudos that they deserve, because oftentimes they're working long shifts. They don't get breaks. They're in a dark room in a basement, and they're just focusing on a computer screen and listening to chaotic people on the phone. They're going to be able to dispatch us specific information, and then while we're en route as well, we're also going to get continued information from them once we get more information from the caller. And then we get divided up. Generally, how systems work within the area, within the state, within the country, you're going to have volunteer departments or first responder agencies operating at the lowest level of EMS care, which is going to be your emergency medical responder. So they're going to show up and they're going to provide that first initial care, and they're going to provide life-saving interventions, stopping the bleed. airway management, some of the very basic components of EMS. And then we have EMTs and or paramedics who are going to arrive on scene depending on the agency. A lot of volunteer departments utilize EMTs as well, but they're going to provide a little bit advanced level of care that the EMR cannot. EMTs can transport individuals, so they can be working on a transport ALS service or a transport BLS service. Depending on the specifics, the EMTs are going to go ahead and transport that individual, and they are going to hand off that patient to the emergency department staff or the ER staff, and or they might call for an advanced life support ambulance in which you would get 2 paramedics and they would transfer that patient from the BLS transport unit to the ALS unit. And then, depending on the patient's severity, they will be transferred within that hospital setting to a specific area. If it's cardiac in nature, they'll go to the cardiac unit. If it's a stroke patient, they'll go to the intensive care unit, what have you. So again, we have a patient. We have somebody going off the road. We have a significant mechanism of injury. A witness is going to go ahead and activate that 911 system. Calling 911, that emergency medical dispatcher is going to get the call, see who's available, who's closest, and is going to be able to dispatch that information. From there, we're going to get that first response unit and then also our EMTs and ambulance transport arriving on scene to facilitate that care, transport, and eventually move on to the ER staff, and in which they'll stabilize them and get them to the appropriate unit. So as far as accessing the EMS system, we have a 911 system which is telephone driven. So when somebody activates 911, generally it's going to be through the phone. And now we have 3 different systems. We have basic 911, and then we also have enhanced 911. So when you have a basic 911 system, the caller is going to have to tell you the specific address that they're located at in order for that dispatcher to actually send them to that location. With an enhanced 911, there's 2 steps. There's the first step 1 of that enhanced 911 system, which is going to allow the dispatcher to see the closest cell phone tower that cell phone activated from when they received that call. And then the second step, which eventually we will get to in the future, is based on that cell phone call, we'll get the exact longitude and latitude of where that call was made. Within the 911 system, emergency medical dispatchers, they are trained, and a lot of them have advanced medical training, and they're able to provide callers with specific treatment plans so that they can start doing CPR or stopping the bleed for those individuals before we even get on scene as far as emergency medical responders. Generally, 911 systems are going to be governed by the specific counties. So in St. Louis County, we have a dispatch center. Lake County, Carlton County, Cook County, they all have their own 911 contacts. Depending on how big that county is going to be dependent on how many 911 dispatchers they have, or whether it's one dispatch unit or multiple dispatch units. So within levels of EMS training, you guys are currently training in order to become EMTs. So we have 4 different levels of EMS training. First, we have emergency medical responders. This generally is about 80 hours worth of coursework and clinicals, and afterwards, you are going to be kind of the bare minimum as far as what you can do on scene. But these are very important individuals in the fact that they are going to be able to handle a lot of life-saving interventions for critical patients before EMTs and or paramedics can arrive. The second level, which is going to be us after we have completed this class, is going to be emergency medical technicians. So this roughly is about 180 to 200 hours worth of coursework, education, training, and clinicals. This unit can go ahead and transport patients. They work independently as far as a BLS level transport unit, and they can provide some advanced level of care. We then have the advanced emergency medical technician. This is not actually recognized by the state of Minnesota, and we'll talk about states' roles within EMS in a little bit. But as far as the national curriculum goes, there is advanced EMTs out there specifically closest to us in the state of Wisconsin. But they can provide some more advanced treatments as far as IVs and administering some different medications. And then the highest level of EMS training is going to be the paramedic level. So this roughly is about 1,000 to 1,200 hours worth of coursework, clinicals, education, up until about 2,000 hours worth of coursework, depending on what program that you go through. So they basically act as registered nurses and or physicians on the scene of an EMS unit. So breaking down, again, the components needed within the 911 system, we have a patient who's involved in a motorcycle accident, and we have first response show up. First response is going to provide that initial life-saving technique, stabilize, open up the patient's airway, make sure that they're in a proper position so that they don't aspirate on their vomit. We then have EMTs. They arrive on scene and they can initiate that initial transport. They're going to provide a little bit more advanced care. And then when we have that paramedic arrive, this is where we can start looking at more advanced treatments as far as IVs, IOs, medications, utilizing the cardiac monitor, and a little bit more pathophysiology. So traits of a good EMT: physical traits and personal traits. The textbook is going to list a variety of different traits that you need in order to become a good EMT, but I want you guys all to take the next few seconds and really think about what it takes in order to become a good EMT. With emergency medical services, law enforcement, and fire, we have the highest level of trust out there than any other profession, because we are allowed into people's homes, into their place of work, taking care of their sick and injured children without their witness. There is a lot of trust out there, and we always have to hold the highest amount of integrity. And integrity is going to be classified as doing the right thing even when nobody is looking, because that's what we're doing as emergency medical services providers. Keep in mind when we're looking at physical traits that we have a very physically exhausting job. So we have to be in good shape. We have to take care of ourselves as far as health aspects, both physically and mentally. And we're going to talk about that more when we dive into chapter 2, the wellness of the EMT. But what I want everybody to do is write down what you think are the most important physical traits and the most important personal traits of an EMT. And I want you to keep that with you all throughout the duration of this class. Once we get done with this class, I want you to open up that piece of paper again and add to that list. Because once we've actually dove into what it all entails as far as being an EMT, your list is going to change and you're going to have a lot more information added to that. But think of the basic ones for right now, and we're going to start adding to that as we progress through this course. Education needed. So once you have completed this class, you are going to have the base knowledge as far as education and training in order to test out for your National Registry of EMT certification. Once you receive that EMT certification from the National Registry, now that's marked as a certification, not a licensure, you'll go ahead and apply for your license with the EMSRB, which is your license to practice within the state of Minnesota. Every 2 years, you need to renew your license and your certification. And you can do that through continuing education. Most of the time, continuing education is going to be done in-house by your training officer, by outside individuals coming into your specific agency and providing that coursework. So with continuing education, think of where will you become a provider, because that's all going to be dependent on what your continuing education is going to look like. I already touched on that. So here, a couple of different examples as far as how you obtain your continuing education. This is the Arrowhead EMS Conference, which is hosted every year in the city of Duluth. So they provide a lot of different seminars, conferences, training, and you're able to get that continuing education through that format. Here, as discussed, we have in-service training, in which case your hours in training will go to meet the requirements set forth in order for you to renew your license. We can also do online programs, and then those hours will correlate to the overall objectives that we need in order to make all the hours needed for our renewal. So once you've completed the course, you passed your National Registry of EMTs, you applied for your state license, and now you're working someplace. Your certification with the National Registry and your license with the EMSRB is going to have an expiration date 2 years from when you got that, roughly, because the National Registry and the state EMSRB license, your license is always going to expire March 31st, even year or odd year, depending on when you get your license. So generally you have 2 years in order to obtain 40 hours of continuing education in order to renew your license and your cert, as well as renewing any other specialty certifications like your American Heart Association CPR card. Once you finish that 40 hours, you can apply to renew your license and your cert, in which those both will be good for the next 2 years. This last cycle of updated protocols and guidelines, the state of Minnesota adopted the Mark King Initiative, in which every EMT provider out there has to uphold their national registry, which is nice because we don't have to focus on doing 2 different lesson plans as far as education in order to meet your continuing education. Everything's the same. Then we have quality improvement and quality assurance. So quality improvement and quality assurance is the dynamic of the system to continuously improve its protocols, its guidelines, and how it cares for its patients. So your role within quality improvement as an EMT, the first and foremost best thing you can do in order to make sure that you're improving as far as quality improvement goes is proper documentation. Documentation is such an important aspect within EMS. This is a legal document, so if you don't provide the proper documentation, you could potentially get taken to court and you could get thrown up on the stage, or excuse me, the witness stand, and get drugged through the mud. And then again, with documentation, we're collecting all of the data associated with the system as far as what we witness, what we see, what we do on scene, and then we can tailor our training, our education, and our updates based on that documentation. Become involved with the quality process. So a lot of agencies, there's actually a number of individuals who serve within quality improvement and quality assurance where they review run documentation. They review equipment failures and maintenance and really tailor and improve that program. Maintaining your equipment. So a quality improvement and quality assurance component is evaluating performance based on equipment. So a highlighting factor would be if you arrive on scene and you have a cardiac arrest patient, you go to turn on the AED and the batteries are dead. That's a highlighting quality improvement factor. So by maintaining your equipment, you're going to you're going to make sure that that system is continuously improving. And then again, continuing education by ensuring that you are upholding the best standards that you can possibly do. The next is medical direction. So medical director, they're going to oversee all of the responsibility as far as that EMS care for that specific EMS agency. Medical direction, this is going to be the oversight, and this is going to be specific to patient care aspects within the EMS system. So medical director is a person who oversees. Medical direction is the medical director's guidance as far as pre-hospital care. Medical director responsibility is to make sure that we have a specific set of protocols and guidelines in order to create kind of a football mapping, if you will, as far as what we should be doing in specific circumstances when we come across a patient. So you're going to have a protocol for a patient experiencing chest pain, and it's going to give you a guideline as far as what you should be doing in each step for a patient experiencing chest pain. Now, this is a general guideline or a protocol. You should follow that, but then there is also a lot of levels of interpretation for as far as how you treat that patient. A designated agent, that's going to be us. We are a part of the EMS agency, and we are working under the specific medical director. Standing orders. So this is going to be, again, associated with the protocols or guidelines. So standing orders are also classified as offline medical direction. So the medical director, utilizing their medical direction, has stated that me as an EMT can give 324 milligrams of aspirin in the event that a patient is experiencing chest pain. I do not need to speak directly to the medical director in order to do so. So this is going to be offline. Online medical direction is going to be a little bit different. So there's going to be certain protocols and guidelines that we have that we need to get permission from the medical director or from a physician at an emergency room prior to actually performing that skill. So let's say that you start working for an agency and you are allowed to do IOs only if you get permission from a medical director or a physician in an ER. You have to specifically talk to them, whether it's via radio or via cell phone, and they have to give you the permission. So how that works is, I want to do an IO on a patient. An IO is called intraosseous, which we drill a screw through a patient's bone in order to give a medication or fluid. I call St. Mary's Hospital on the phone, ask to talk to a physician inside the emergency room. I tell them what's going on, my patient, what I want to do, and then that medical director is going to go ahead and say, yes, perform that skill, or no, don't perform that skill. And that's going to be online medical direction. Make sure that we are documenting properly with all of that. Again, the way that we can do this, so this is a radio component, talking to a physician at the emergency room. Some medical directors carry their radio with them all the time, so that EMS designated agents are actually talking to their medical director all of the time. So the EMS role in public health, I really dove into this earlier. We got injury prevention, we have blood drives, we have blood pressure checks, we have glucose checks, providing information for youth, getting into schools, high schools, middle schools, elementary schools, providing different topics for that. Again, this is a very important subject within emergency medical services, because we have to start doing a better job of prevention instead of just responding to those specific agencies. That concludes chapter 1. As I mentioned in our introduction, I did not cover every specific component within the chapter, because you guys as EMTs have to start finding out resources in order to educate yourself as well. Because EMS isn't all about knowing all of the answers, it's knowing where you can find those answers in a short manner. So again, read the chapter, do your homework assignments, your pre-test and your post-test, and get ready for chapter 2. This is the first step within our journey together as far as becoming really good EMTs and making a difference out there in the community. Thanks, everybody.